obesity and how is it measured in youth? Obesity is an excess of adipose tissue or fat in the body and is usually a result of energy imbalance. In other words, too many calories in coupled with too few calories expended. Body mass index, or BMI, is a measure of body fat based on weight and height. BMI trends in patients over the age of 2 are followed on standardized BMI for age and sex growth charts, such as the example illustrated here. The CDC defines obesity in the pediatric population as a BMI at or above the 95th percentile for children over 2 and adolescents. And overweight children are defined as having a BMI at or above the 85th percentile and up to the 95th percentile. What is the magnitude of the problem? Pediatricians and medical experts recognize that childhood obesity is a worldwide epidemic and the prevalence is rising. As illustrated in this graph, prevalence trends are on the uptick for many regions spanning across all socioeconomic levels. In the United States, the obesity rates among young children between the years of 1963 and 1965 were recorded at roughly 4%. And then between 99 and 2000, the rates rose to around 15%. And between the years of 2015 and 2016, the overall childhood obesity rate climbed to an alarming 18.5%. In addition, in 2016, an estimated 42% of children aged 5 to 19 in the United States were overweight, compared with an overweight estimate of about 19% in 1975. What are the consequences of childhood obesity? Unfortunately, the consequences of obesity among children are numerous. Obese children are prone to develop diseases and disorders of many organ systems. Some include endocrine and metabolic conditions such as polycystic ovary syndrome and type 2 diabetes, gastrointestinal issues such as non-alcoholic fatty liver disease, neurologic problems like pseudotumor cerebri, orthopedic conditions such as slipped capital femoral epiphysis, hypertension, sleep apnea, and numerous adverse psychological, behavioral health, and academic consequences, not to mention increased risk of severe COVID-19 disease. One of the greatest concerns about obesity in childhood is that the disease often carries over into adult years with an even greater potential for medical comorbidity and premature mortality. Awareness of the magnitude of the problem and acknowledgement of the potential gravity of the situation are the first steps to treatment and prevention. Please visit Elsevier's Obesity Hub for resources to help clinicians tackle this challenging epidemic health problem.